Lyme disease is one of the favorite exam topics, and some of these next few rashes. Like I said earlier, everything here is high yield, but this is more than high yield. So we're going to discuss Lyme disease. It is caused by Borrelia burgdorferi, which is a spirochete. It is in a lot of states in the United States, reported just about everywhere. But you do need to know your geography when you're taking this exam for certain diseases. It is carried by the deer tick of the Ixodes species. Here you see on dark field examination, all of these are spirochetes. All these little squiggles, those are the spirochetes. Okay? And these are the ticks that carry Lyme disease. The actual tick that carries Lyme disease is really small, more along these lines. Very rarely, you'll see the mom will say that she pulled a big tick off the child. That's probably not the Lyme disease. It's a very, very small tick. Lyme disease is named actually for Old Lyme, Connecticut. It was first described there. There was a mom who had a child who developed some mysterious signs and symptoms, and she took the child to various doctors. Eventually they said, oh, your child has rheumatoid arthritis. And said, oh, that's a terrible diagnosis. But then she realized that there were other kids in the area that were having the same diagnosis. So she persisted, and people started looking a little bit more into things, and they found other things in common and came up with the actual disease. It comes in various stages. The first stage is early localized disease, and the rash is called erythema migrans. Now, a lot of these rash names are going to be confusing. So this is erythema migrans. Afterwards, this is the rash that appears. It looks like, at the side of the tick bite, it looks like a spreading rash with reddish borders and central clearing. Sometimes it even looks almost like a ringworm. That can have a little bit of fever associated with it and some malaise, and the child gets better actually, and the rash goes away. After a certain amount of time, the child can go on to progress to develop the early disseminated disease, which is a secondary erythema migrans, and this type of disease is going to be characterized by a Bell's palsy. Okay? So if they start talking about neurologic problems or even a carditis, then you should start thinking about Lyme disease. The patient can actually get better from that, and then after a certain period of time progress to the third stage of the disease, which is actually the arthritis stage of the disease. And the arthritis will occur in the large joints. They can also have a peripheral neuritis, but look for stage number 1, rash. Stage number 2, Bell's palsy or carditis. Stage number 3, arthritis. And here you see the rash of erythema migrans. It's this reddish area here. Usually the tick bite is in the center, and you can get a little bit of central clearing, and it'd be erythematous and slightly raised. There's no really great test to diagnose Lyme disease, so you probably won't get that as a question. You can get titers and look for antibodies. It's best to do quantitative ELISA and then do a Western blot. You can also culture it. Treatment. Early on, like the first stage of the disease, it's recommended that you use doxycycline. However, remember about staining of the teeth with tetracyclines and all, so you want to avoid that in children that are less than 8 years of age. If they're 8, 9, 10, that's fine. If they're 5, 6, 7, then you have to use amoxicillin. For the meningitis, now we're talking about a second stage, or the carditis, which is not that common, it's listed there. You're going to use ceftriaxone or penicillin, but for a longer period of time. For Bell's palsy, also doxycycline, or you can use amoxicillin, depending on the age, for a longer period of time. And in the late stage, you're going to be, again, doxycycline or amoxicillin, depending on the age, for a longer period of time. The prognosis is very good if you catch it early.